Weaving through the capital, a picture of urgency. The coronavirus coupled with winter makes for a cocktail of mounting infections. London and the southeast of England are feeling the strain, with the capital's ambulance service receiving 8,000 calls on Boxing Day. It was one of their busiest days ever. Paramedic Richard is on the front line.
I think there's three factors really. One is there's a number of staff who are off sick either with COVID or isolating as a result of family members who've got COVID. We're seeing an increase in workload because of patients with COVID or with difficulty breathing. And the ambulance crews are often spending several hours at hospital waiting to offload their patients, which means there are less ambulances available. So we see a number of calls waiting, and certainly I've experienced patients waiting several hours for an ambulance currently.
Medics at Queen's Hospital in East London speak of treating patients in the back of ambulances. We spoke to one doctor who told us that all beds were full and they were running a one-in, one-out operation. Ambulances in and out of St Thomas's Hospital also reinforce the stresses of those on the wards.
It's very tough. We've had a combination of, you have this increased demand, ambulances keep coming in. We are desperate to offload ambulances. That's always been a priority for us because we know that, an ambulance needs to be available to go and see the next person who's in a car accident or who's having a heart attack, and they need to be available to go. And you feel terrible and a sense of helplessness when you can't offload an ambulance because your emergency department is full.
There are 4,000 people in London hospitals being treated for COVID-19. Nationally, the number of people in hospital with the virus is thought to be nearly as many as during the peak of the first wave. It's thought the new variant is to blame. Public Health England have tonight made a rare intervention. Their medical director said this very high level of infection is of growing concern at a time when our hospitals are at their most vulnerable, with new admissions rising in many regions. We've all made huge sacrifices this year, but we must all continue to play our part in stopping the spread of the virus, which is still replicating fast. The vaccine remains the ray of hope, with news the Oxford-AstraZeneca jab could be approved by the regulator in the coming days. Winter carries its own pile of pressure, with respiratory viruses favouring colder climates. A worry on the mind of those in the capital, clambering to contain the spread. Ashna Harinag, Sky News.